to be aimed at reducing poverty outcomes in families and the measures to support lone parents, but all of the measures that were introduced by the previous Minister, Joan Burton, show that lone parents were actually poverty increased in the families of lone parents. I won't read you out the stats here, but what is absolutely clear is that the measures to activate employment for lone parents actually forced more of them out of employment, because when you, as was said by the previous deputy, when you talk about reducing poverty, you have to look at it in a holistic way and look at the provision of childcare and housing supports in particular. Housing, as we know, is in a massive crisis and the rents are soaring through the roof. And also, tomorrow we're going to have a strike in Tesco's nationally, which is the type of low-paid job that many lone parents are being forced into and forced to seek more hours in those kind of jobs, which pay very, very badly indeed. So there's no point of talking of pushing lone parents into work and out of poverty unless you're looking holistically at the sort of supports that are put in place for them, including childcare, housing and the rate of pay that they can expect to get in employment, including the low level of the minimum wage at the moment.
Minister to respond, please.
Thanks. Just a few things. Just in relation to Dr Miller's report, I haven't personally seen any of the drafts yet, but it is very definitely not an impact assessment. That's not what was commissioned. What it is supposed to be is advice on best practice and best examples from other countries, or at least that's the work that was asked for. I recall Deputy Burton's comments, but not exactly the time they were made. I think perhaps that was before the job seekers transition payment came in, and that's for lone parents whose youngest child is no younger than between 7 and 14, and that doesn't require that they be in full-time work. Part-time work is enough, or education, and it's accepted that it's only when the youngest child is 14 or older that it's expected that lone parents take up full-time work. When it does come to Nordic countries and Scandinavian countries, and by the way, that is the models I'm most interested in, those in Denmark and other countries, activation starts much younger. It starts at 2 or 3. That is impossible in Ireland, given the cost and non-availability of childcare. And I do absolutely agree with Deputy Smith's point that you must look at it holistically. You have to take into account childcare pay rates and housing supports if we're serious about getting people off welfare and into work. But those things should not be used as an excuse to do nothing ever.
Thank you very much. Again, Deputy O'D and Deputy Smith, you have a minute each.
The statistics that Deputy Smith adverted to are very simple. It means that the statistics show, the latest figures show that 22%, more than 1 in 5 of children of lone parents are living in permanent poverty. Permanent poverty. It also shows that almost 60% of children of lone parents, that's 3 out of 5, are suffering deprivation. In other words, they are deprived of some of those things that they're deprived of some of the number of things that make up a decent standard of living. Now, can I say to the Minister that all the experience, both anecdotal and otherwise, shows us that the net effect of the changes introduced by Minister Burton is that lone parents, particularly working lone parents, are worse off. So there is a direct link between the rising rate of child poverty amongst lone parents and these changes. So can I ask the Minister again if he will do a financial impact study? I mean, a number of organisations such as Spark have done very, very good financial impact studies which show the impact of those changes. And I mean, can I ask the Minister, what's the rationale? I mean, his predecessor said the rationale was to get more lone parents out to work. You know, how do you get more people out to work? By ensuring that when they go out to work, they're going to get less income.
All right, thank you, Deputy Smith.
Just to add to that, prior to the measures taken by the previous Minister, Joan Burton, in 2012, 60% of lone parents were in some form of employment, not necessarily all full-time employment, but some form. And by 2014, that figure had dropped to 36%, precisely because it was costing lone parents more to go out to work than to stay at home and be lone parents in the home. So the measures taken by the previous Minister did not fit the bill of what's required. And when we talk about equality proofing in the budget, I think we're going to need equality proofing on the programme for government, because your programme minister talks about a new work and family payment. We've gone from the one parent family payment to a new payment which includes being able to collect family income support, and now you're talking in the programme about changing that again to work and family payment. And what we're arguing here is that you should not even dare to move to that until Dr Miller's report is published, that we've a chance to look at its findings. You say that they're not about comparisons, and that is not an excuse to do nothing, but it's certainly not an excuse to make the same mistake again and drive more lone parents further and further into poverty, and indeed their children. And as the stats have shown, 1 in 5 children of lone parents do live in chronic poverty. So what we're saying here is don't do anything in terms of a new payment until the Miller report is published. We want to see that report. We want to have a chance to study it and to look at what's the best methods of paying and supporting lone parents in this state.
Minister, to respond, please.
I'll say again that the report, the draft of which I haven't seen, is not supposed to be an impact assessment. That's not what was commissioned, and not what it's entitled. But obviously, it'll be published in due course. One of the best things about the Department of Social Protection is that we do have so much statistics in this area, and there is so much academic study in these areas, albeit some of that academic study coming from a particular point of view or a particular ideology, but nonetheless it should be taken into account and listened to. I wish I had the access to such statistics in health, because it would have been easier to make informed decisions, but you do actually have to understand how these statistics are collated, and it's very interesting to see how they're collated and how things are measured, and how just the way you measure something can give you
Minister, to respond. Please, Deputy Smith.
Can give you a totally different answer. But if you want to talk about statistics, the most recent ones that we have are the SILT Survey of Income and Living Conditions.
Minister, your time is up. Thank you, Minister.
I would like to answer these questions, but
it would have been useful if you weren't interrupted.
I know.